3 simple vitamins could be the difference between protecting your kidneys and watching them slowly fail. I'm talking about the top 3 vitamins proven to help stop proteinuria, that foamy urine you see in the toilet, and heal damaged kidneys naturally. But here's the strange part. Why are so many people doing everything right and still seeing their kidney numbers get worse? They're eating clean, staying hydrated, even taking their medications on time, yet their urine still looks bubbly day after day. They're avoiding red meat. They've cut out soda. They're watching their salt and sugar carefully. Maybe that's you too, doing everything the doctors told you, but still wondering why the foam never goes away. The truth is, there's something most people never think about. A quiet deficiency that slips under the radar. Not a new drug, not another detox, but missing nutrients. Your kidneys desperately need to repair themselves. Think of your kidneys like coffee filters. When they're healthy, nothing important leaks through. But when they weaken, essential proteins start slipping out, and that's when the foam appears. The right vitamins can actually help those filters rebuild. Ignore that early sign, and silent scarring can keep spreading. Once that damage sets in, no diet or supplement can fully undo it. So today, let's cut through the noise. No gimmicks, no hype. Just science-backed solutions you can start using right now. These are the 3 vitamins your kidneys have been waiting for. Now, let's talk about why vitamins play such an important role in protecting your kidneys and stopping proteinuria. The role of vitamins in kidney health. Your kidneys are remarkable organs. Every minute, they filter your blood, remove waste, balance fluids, and keep your blood pressure steady. When they're working properly, almost no protein escapes into your urine. But when the tiny filters inside your kidneys, called glomeruli, become inflamed or damaged, they start leaking protein, and that's when you see foam in the toilet bowl. What's often overlooked is that people with kidney problems tend to lose essential vitamins faster than healthy individuals. And when your body runs low on these nutrients, your kidneys struggle even more to heal. There are a few key reasons for that. First, when those delicate kidney filters are damaged, they don't just let protein leak out. Vitamins and minerals can slip through too. Second, many people with kidney issues experience a poor appetite or a distorted sense of taste. Food simply doesn't appeal the way it used to, and that leads to eating fewer nutrient-rich meals. Third, as kidney disease progresses, doctors often recommend limiting certain foods that are high in potassium or phosphorus, like beans, some fruits, and dairy, which also happen to be rich in vital vitamins. And finally, for people on dialysis, the process of filtering blood mechanically can wash away even more nutrients. All of these factors create a silent deficiency that makes it harder for your kidneys to recover. The good news is that the right vitamins, whether from food or from carefully chosen supplements, can help your kidneys repair tissues, reduce inflammation, and prevent further damage. So which vitamins matter most when it comes to stopping proteinuria and supporting kidney repair? Let's start with one of the most powerful, vitamin D. Vitamin D is one of the most powerful nutrients your kidneys need to stay strong and heal. It helps calm inflammation inside those tiny filters, reduce protein leakage, and protect your kidneys from further scarring. For many older adults, getting enough vitamin D can make a real difference in slowing down proteinuria and improving overall kidney function. When your kidneys are damaged, they struggle to balance blood pressure and filter waste effectively. Vitamin D steps in to restore that balance. It helps lower the overactive hormones called renin and angiotensin, which can cause high pressure inside your kidneys and make the damage worse. It also supports your body's natural antioxidant system, fighting off the free radicals that slowly scar your kidney tissue. In simple terms, vitamin D helps those filters rest, repair, and rebuild. Still, more isn't always better. Because vitamin D is stored in body fat, taking too much can raise calcium levels in your blood and lead to kidney stones. People with high calcium, or those already diagnosed with kidney stones, should talk to their doctor before using supplements. Always aim for the right amount, not the maximum. Most adults need around 600 international units of vitamin D each day, while people over 70 may need about 800. You can get it naturally from moderate sunlight, from foods like salmon, mackerel, eggs, and fortified milk, or from a doctor-approved supplement. If you take a supplement, have it with a meal that includes healthy fats like avocado or olive oil to help your body absorb it better. If you don't like fish or dairy, you can still boost your vitamin D with plant-based options. Try mushrooms that have been exposed to sunlight, or fortified almond or oat milk. These are simple, kidney-friendly swaps that help you stay consistent without feeling restricted. For those taking prescription medications or with advanced kidney disease, always confirm with your healthcare provider before starting any vitamin D supplement. It's important to balance your levels safely and avoid interactions with other treatments. I'm Dr. Mattheus from Kidney Health 365. If you find this helpful, please subscribe, like this video, and share it so more people can protect their kidneys the natural way. Now that we've seen how vitamin D helps calm inflammation and strengthen your kidney filters, let's look at another essential nutrient that protects those filters from damage: vitamin E. Vitamin E is another key nutrient your kidneys depend on to stay protected. It acts like a shield, guarding those tiny filters inside your kidneys from inflammation and the constant wear and tear caused by toxins and free radicals. For people with proteinuria, vitamin E can help reduce the leakage of protein in urine and support the repair of kidney cells. Inside your body, vitamin E works as a powerful antioxidant. It protects the delicate cell membranes that line your kidney's filtering system from oxidative stress, the damage caused by unstable molecules that build up when your kidneys are under strain. It also supports a natural process called autophagy, where old or damaged cells clean themselves up and make room for healthy ones to grow. By improving this process, vitamin E helps your kidney tissues recover more efficiently and stay strong against further injury. But like any nutrient, balance matters. Too much vitamin E can thin your blood and interfere with clotting, increasing the risk of bleeding. Taking high doses over long periods has also been linked to other health problems. If you're taking blood thinners, have a bleeding disorder, or a history of certain cancers, you should talk with your doctor before using supplements. For most adults, about 15 milligrams of vitamin E a day is enough. Some people with kidney problems may benefit from a slightly higher dose, but it should only be done under medical guidance. The best way to get vitamin E is through food nuts like almonds, walnuts, and Brazil nuts, or seeds like sunflower and pumpkin seeds. You can also find it in avocados, spinach, red bell peppers, and vegetable oils such as safflower or olive oil. To absorb it well, always pair these foods with a small amount of healthy fat. If you don't enjoy nuts or seeds, try blending a small handful of spinach and half an avocado into a smoothie, or drizzle olive oil over cooked vegetables. These small changes make it easy to add vitamin E into your meals without feeling like you're on a special diet. If you have any chronic conditions or are taking medications, especially anticoagulants, check with your healthcare provider before adding vitamin E supplements. This simple step ensures you get the benefits safely without unwanted interactions. If you've never paid attention to vitamin E before, type 0 in the comments. And if it's already part of your daily routine, type 1. I'd love to know how you're supporting your kidney health. Now that we've covered how vitamin E protects your kidneys at the cellular level, let's move to another vitamin that plays an equally vital role in reducing proteinuria and improving blood flow within your kidneys. Vitamin B9, also known as folate. Vitamin B9, also known as folate or folic acid, is one of the most important vitamins for protecting your kidneys and reducing protein in the urine. It helps your body make healthy blood cells, supports circulation inside the kidneys, and reduces inflammation that can quietly damage kidney tissue over time. For people living with high blood pressure or chronic kidney disease, getting enough vitamin B9 can make a real difference in slowing the progression of proteinuria. Folate works in several ways to protect your kidneys. First, it helps lower levels of a harmful amino acid called homocysteine. When homocysteine builds up in your blood, it can inflame blood vessels, weaken kidney filtration, and increase the risk of clots. Vitamin B9 helps break down this compound, so your kidneys and heart stay protected. It also helps balance phosphorus levels in people with advanced kidney problems, which prevents calcium from forming tiny deposits in the kidneys and blood vessels. Over time, this means less scarring and better kidney function. But just like other vitamins, taking too much folic acid can backfire. High doses can hide a vitamin B12 deficiency, which can cause nerve and blood problems if left untreated. Too much folate may also increase certain cancer risks in people with existing health conditions. Always talk to your doctor before taking more than the recommended daily amount. Most adults need about 400 micrograms of vitamin B9 each day. You can get this from dark leafy greens like spinach, kale, or arugula, from vegetables such as broccoli, asparagus, and Brussels sprouts, and from foods like eggs, beans, walnuts, and flax seeds. Many cereals, breads, and pasta are also fortified with folic acid, making it easier to reach your daily goal. If your doctor recommends supplements, stick to what they prescribe, especially if you have kidney disease or take medications that affect folate metabolism. To make your meals more interesting, try adding chopped spinach to your scrambled eggs in the morning, or toss steamed broccoli into your rice at dinner. Both add folate naturally and blend easily into familiar dishes. These small daily choices add up over time and can strengthen your kidneys without drastic diet changes. If you're currently on dialysis or taking medications for high blood pressure, let your doctor know before adding any new supplements. They can check your folate levels and ensure you're getting the right balance for your stage of kidney health. If you've never heard about the connection between folate and kidney repair, type 0 in the comments. If you're already adding folate-rich foods to your meals, type 1. I'd love to know what's working for you. Now that you understand how vitamin B9 helps reduce inflammation and support healthy blood flow in your kidneys, let's talk about when you should see your doctor and what signs might mean your kidneys need more help than diet alone. Precautions. When to see your doctor. Even when you're doing everything right, eating better, taking your vitamins, staying hydrated, there are still times when your body needs medical attention. The key is knowing what warning signs to look for. If you start to notice that your urine looks darker, thicker, or consistently foamy, don't ignore it. That foam is often a sign that your kidneys are letting too much protein pass through. You might also see puffiness in your face, hands, or ankles. This happens when your kidneys can't remove extra fluid properly, and it starts to build up under your skin. Some people experience nausea, vomiting, or muscle cramps, especially at night. These symptoms can mean your electrolytes are out of balance because your kidneys aren't filtering waste as they should. And if you ever feel chest pain, shortness of breath, or sudden fatigue, don't wait. Call for help right away. Those could be signs of more advanced kidney or heart problems. It's also important to talk to your doctor before making big changes to your diet or starting new supplements. Your doctor can check your blood and urine tests, review your medications, and make sure your vitamins won't interfere with your treatment. Remember, kidney disease often progresses silently. By the time symptoms appear, damage may already be advanced. Early testing and communication with your healthcare provider can make a huge difference in protecting your kidney function for years to come. So if you're seeing any of these warning signs, don't wait until it gets worse. Schedule that checkup. Get your labs done. A simple urine test could reveal problems before you feel them. Now that you know when to reach out for help, let's focus on what you can do every single day to keep your kidneys strong. In the next section, we'll talk about simple lifestyle habits that help prevent kidney damage and support long-term healing. Prevention tips. While not every case of proteinuria can be prevented, there's a lot you can do to protect your kidneys and keep them working at their best. Prevention starts with simple, steady habits you can maintain every day. First, stay active. Gentle movement like walking, swimming, or light stretching helps improve circulation and keeps your blood pressure in a healthy range. When your heart and blood vessels are strong, your kidneys don't have to work as hard to filter waste. Second, keep your blood sugar under control. High blood sugar quietly damages the small blood vessels inside your kidneys, which can lead to protein leaking into your urine. Even small improvements in your daily meals, like choosing whole grains over refined carbs or cutting back on sugary drinks can make a big difference. Third, focus on balance in your diet. Eat more fresh fruits and vegetables. But remember, moderation matters. Avoid large portions of foods that are very high in potassium or phosphorus if your doctor has advised you to. The goal isn't perfection, it's consistency. Fourth, drink enough water. Staying hydrated helps your kidneys flush out toxins. But that doesn't mean overhydration. For most older adults, about 6 to 8 glasses a day is a healthy range unless your doctor recommends otherwise. And finally, take your medications exactly as prescribed. If you're on medicine for blood pressure, diabetes, or cholesterol, those pills are protecting your kidneys too. Skipping doses can undo progress you've worked hard to make. Protecting your kidneys isn't about doing everything perfectly, it's about doing the small things consistently. Every healthy choice adds up over time. Now that you know how to take daily action to prevent kidney damage, let's bring everything together. In the final section, we'll review what we've learned and share one powerful message to help you stay motivated and hopeful on your kidney health journey. Today, we learned that 3 key vitamins, vitamin D, vitamin E, and vitamin B9 play a major role in reducing proteinuria and protecting your kidneys. Vitamin D helps calm inflammation and lower blood pressure inside the kidneys. Vitamin E shields your kidney cells from oxidative damage and supports their natural repair process. And vitamin B9 helps lower harmful homocysteine levels, improve circulation, and protect your kidneys from scarring. Kidney problems often progress silently. You may feel fine now, but by the time symptoms appear, the damage could already be advanced. That's why starting today matters. Every small step you take, eating nutrient-rich foods, staying hydrated, following your doctor's advice, can make a powerful difference in protecting your kidneys for years to come. Remember, healing doesn't happen overnight, but consistency works miracles over time. Your kidneys are resilient, and with the right nutrition and care, you can give them the support they need to recover and stay strong. After watching this video, take one simple action today. Check your diet to see if you're getting enough of these 3 vitamins. If not, add one kidney-friendly food to your meals this week, like salmon, spinach, or a handful of almonds. Small habits like these are the foundation of lasting kidney health. Keep in mind that the information in this video is for educational purposes only and should not replace medical advice. Always talk with your healthcare provider before making major diet or supplement changes, especially if you have chronic kidney disease or other health conditions. If you found this helpful, please subscribe to Kidney Health 365 and turn on all notifications so you never miss a new video. And before you go, watch the next video on your screen where we reveal the 22 foods that can quietly harm your kidneys and how to find safe, delicious alternatives. Stay informed, stay healthy, and I'll see you there.